that right? So what we've done is we've turned the lights down low. Okay, so hopefully that's just a little bit gentler for you. Okay, so tell me a little bit more about these migraines. Yeah. Okay. Is it always like that? Yeah, okay. So if you had to rate the severity of the pain on a scale of 1 to 10, what kind of number where would you place it? Yeah, so pretty high on the list, okay. So roughly how frequently would you say these migraines are? Yeah. Would you say that you get multiple in the same week? Sometimes, okay. So generally we're looking at 1 a week, sometimes more. That is still quite a lot, okay. So roughly how long do they last on average from beginning to when it's fully gone away? Okay. Couple of hours, right? Yeah. I can see how that would be quite troubling and interfere with your life to be going through that on a weekly basis. Okay, so what does the pain feel like in your head? Like a pulsating? Okay, yeah, that's quite common. And would you say that it's all around your head, or is it more to one side, or the front or the back? To the left? Okay. Right then. Do you get any other symptoms generally, such as sensitivity to light? Yep. Sensitivity to sound? Okay. Nausea, sickness? Okay. Dizziness? Anything else at all? Okay, right. Some people with migraines tend to get a warning sign, and it can be different for everyone. Some people report dizziness beforehand or seeing some kind of visual horror. Can you think of any kind of warning signs that you get? Okay, well, is this the first time that you've actually been in to a GP to seek treatment for this? The first time? Okay. So what have you been doing to kind of manage it at home on your own? Yeah, like paracetamol, okay. And has that been effective in helping to manage these migraines? To an extent, okay. So, like you said, it was about a 9. Do you find that the paracetamol is helping to reduce the severity of the pain? Okay, only a little, right? Like a 7. How about, do you find that it makes you recover a little bit quicker? Not really. Alright, okay. So, how long has this kind of been going on for then? Okay, right. It might be that you've developed kind of a resistance to the painkillers at this point. it's very common that can happen, especially if you've become accustomed to taking the full dose, and your body kind of gets used to that. Okay, right, well, I'm very, very glad that you've come in. Okay, what we can do is we can talk about some other kinds of medications. We'll do that towards the end. We can also talk about lifestyle factors, stress, diet, sleep, just to see if we can identify any patterns or anything that might be a cause for concern there. And we can also just run a few quick physical tests just to check that there's nothing physically wrong. Okay? Yeah. Unfortunately, often there's no obvious reason for a migraine. It just comes and goes, and it's hard to pinpoint exactly what's causing it. But what we can do is do some tests and go through some questions to help kind of rule anything out. Yeah, and then with the medications, maybe we can get you on something a little bit more effective than paracetamol. Okay, so we'll just begin talking about stress. Now, do you find that you have a lot of stress in your life? If you had to rate your level of stress on a scale of 1 to 10, okay, and have you identified any kind of link between the stress and the migraines? Do they tend to occur on the same day or at the same times? Not quite sure. Okay, that's fine, don't worry. Okay, how about sleep? How well would you say that you sleep? Okay, do you use any sleep aids? Yeah, like white noise machine. I don't know if you've heard of ASMR. Yeah, look it up on YouTube when you get home. It's very, very good for promoting sleep. There's all kinds of different kind of subcategories of it, so you might find that there's some of it that you like, some of it that you don't like. I would say don't rule it out based on the first video that you see. It might be that that's just not the genre for you, so perhaps try something else, but it's very, very good if you are struggling to sleep. Likewise, guided meditations, things like that. Do you spend a lot of time at night looking at a screen? So your phone, your television, your PC, your laptop, Do you work at a screen by any chance? You do, okay, yeah. Could be that the bright light of the screen might be kind of having a influence, so it could be a factor to bear in mind. Screens can be very bright. Perhaps maybe turn your brightness down. You already do that, okay, right. Okay, in terms of your diet and kind of your hydration, would you say that you get enough fluids in a day? What kind of things do you drink then? Yep. Okay. Do you put sugar in your coffee? Okay. Right. Anything else? Do you just drink plain water? Okay, right. Well, it sounds to me like quite a lot of caffeine there with the coffee, the tea, the Coke and the Pepsi, etc. Quite a lot of caffeine. And it also sounds like you're adding sugar to your drinks. I mean, it might not be related, but it's something to bear in mind, the caffeine and the sugar, okay? Just something that we can just keep an eye on. Okay, how about your diet? Do you think you have a healthy diet? Yep, like fruits and vegetables, whole grains, proteins, fiber. Okay. Okay, do you have like a lot of greasy food? Like takeaways or stuff that's deep fried? Okay. Right, so yeah, stress, sleep, diet, then your screen usage, all things that we can kind of bear in mind, okay? Has anything kind of jumped out at you, kind of jogged your memory? Any of those things that might be a trigger for the migraines? Still not sure? That's okay, don't worry. What I'd like you to do for the next, ongoing, okay, until you come back to me, maybe 6 weeks, 8 weeks, I'd like you to keep a migraine diary, okay? So every time you get a migraine, okay, I want you to make a record of it, the date, the time, the severity, how long it lasts, what you had to eat and drink that day, how stressed you're feeling that day, how much screen usage you've had that day, and how well you slept the night before. Any other factors? What else could it be? Whether you had any other symptoms or whether you had any warning signs, okay? So, so just get an empty notebook, start at page 1, and every time you get a migraine, just try and keep a record of all of those things, okay? Can you remember them? Yep, so the date, the time, the severity of the pain, and you can also note down where in your head the pain was, whether it stayed in one place, whether it moved about, how well you slept, how stressed you're feeling, what you had to eat and drink that day, specifically how much caffeine and sugar, how much greasy food, whether you had your vitamins and minerals and your fiber for the day, things like that, or maybe whether you skipped a meal. That could also be relevant. Yeah, skipping breakfast. I have to admit that's something that I do. Sometimes you just don't have the stomach for it when you wake up, but perhaps it can cause a bit of a drop in like blood sugars, and you never know, it could be related, so note that down, okay? Any details that might be relevant, try and keep that diary for a good 6 to 8 weeks, and when you come back we can kind of examine it together to see if there's anything that jumps out. If you notice that the same things are cropping up frequently, maybe just highlight it. Have you got any highlighters at home? Yeah, good. Yeah, so if you're starting to figure it out yourself, notice any triggers, highlight it, okay? Good. So, okay, what we'll do before we move on to the medications, we'll just go through some basic tests, okay? So if I just have a quick listen to your heart. When was the last time you had your heart checked by a doctor? Okay, right, so yeah, I'm gonna place the cold in. It is very cold, I'm afraid. If you wouldn't mind unbuttoning your shirt, and I'll just get this warmed up a little bit. Okay. Yep, good. So what I'm gonna do is just listen to your heart, check that regular, even beat. Okay? Good. Okay, so let's bring it in then. Okay. Yep, try to hold still. Good, try to stay kind of quiet and still. Okay, good. Okay, yeah, seems to be quite regular. Okay, I'm just going to do a little count to see if it's particularly high or low. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60. Okay, that's fine. Yeah, no problem there. Nice even beat. Not particularly high or low. Well within healthy range. Okay. Do you mind if we just take your blood pressure? Yeah, blood pressure can be related. Sometimes it can be related to stress, so it might give us a bit of an indication there. Okay, now I've actually got one of the electronic ones to make it a bit easier. So, yep, you can button up your shirt again, that's fine. However, if you just like to roll up your sleeve, if it's easier, you can slip your arm out if it's a bit tight on your arm. Okay? Good. Right. Okay. Yep, just pop your elbow on the table. That's it. Try and keep it rested. Yeah, don't tense or anything, just keep it rested. Okay. Right. It's just gonna start to blow up now. Okay, good. Yep, just hold still. Okay. Perfect. Okay. Let's go ahead and slip your arm out then. Okay. Excellent. Okay. Yeah, no problems whatsoever. So physically, in terms of your heart and your blood pressure, you're fine. Now, would you mind if I just have a quick check of your eyes and your ears to see if there's anything there that might be kind of contributing? Now, this would involve a bright light, so it's completely up to you if you don't want this. Okay? Yep. Do you find that bright lights can cause migraines to come on? Not really thinking so. Okay. Right. And you're not experiencing a migraine at this very second, are you? No. Alright, so yeah, if I just have a look into your eyes, okay? Lift up your head. Good. The other side. Good, okay. I'm just gonna hold my hand down the middle. Okay, good. Good. Okay. Good. 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 Okay. The pupils seem to be absolutely fine. Let's just do a quick little eye tracking test, okay? Would you rather look at my finger or would you rather look at the light? The light, are you sure? Okay. So just fix your eyes onto the light then. Okay. Yep. Both eyes. Yep. Just kind of follow it. Just following it. Yep. Good. 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 Looking. Make sure we're looking up. Following the light up, 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 up. Up, 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 up. And down. Following the light. Down, 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 down. And left, 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 left. And right, 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 right. Okay. Good. So I'm going to use a slightly different tool for your ears, okay? I'm going to have a little look in and see if your ears have become blocked in any way, or if there's any kind of inflammation or signs of infection. Yeah, especially as you did say that your headache is more on your left side. It could be that there's actually something going on like deep in the ear that could be contributing. Like I said, it's very, very tricky to actually identify a cause for migraines. So the best thing we can do is keep our options open. Everything is a suspect, okay? So I'll come into this ear first, okay? Alright. Okay. Nope. No redness. No redness. That's not too deep, is it? Good. Just let me know if it feels a bit irritating, or if you feel like it's eyes, ears, heart, blood pressure. Okay, so we'll talk about medication then. I've got a couple of options for you. You can choose. Right. So, you could either have topiramate. Have you heard of that? Topiramate. Yeah. So it's actually an epilepsy medication used to reduce seizures, but in low doses it can be regularly used to benefit people with migraines, to prevent and treat. So that's one option. The other option is amitriptyline, which, yeah, you've heard of that one. Yeah, but well, it's not a sleeping tablet, although some people use it as a sleeping tablet. It's actually an antidepressant. Yep, absolutely right. It does make you very, very sleepy. And at low doses, it can also be effective pain relief and migraine control. So I would say not both, but one of those. So topiramate, which is an epilepsy tablet, which can be used for migraines, or amitriptyline, which is a depression tablet, again can be used for migraines. Now before we even think about either of those, I just need to run through some medication safety questions with you. So do you have any allergies to any medications? Okay. Have you ever had any kind of severe reaction to a medication? You ever had any of the more severe side effects from any medication? Okay. Have you ever had any of the common mild side effects from any medication? Okay. Do you have any blood disorders? Okay, good. Are you currently pregnant or trying to get pregnant or breastfeeding? No, good. Are you taking an effective birth control? Okay. Do you have any kidney problems? Okay. Any liver problems? Okay. Any heart problems? Diabetes? Okay. Do you have any eye problems like glaucoma, or does glaucoma kind of run in your family? Any relatives that have it? Nope. Okay. Are you currently taking any nutritional supplements? Yeah, vitamins. Okay, a multivitamin. Okay. Have you been told that you have low calcium? Okay. Right. Do you take any other antidepressants? Okay. Do you take any anxiety medication? Do you take any medication at all, aside from the paracetamol? Okay. Right. And do you have heart problems? We already done that one. Okay. And you don't have epilepsy, do you? Okay. Right. Okay. So then it's really up to you. With topiramate, I would say take it. You can take 2 doses a day. Okay. 50 milligrams split between 2 doses. Spread them evenly throughout the day. Or with amitriptyline, I would start you at 10 milligrams, and I would say take it at bedtime. It can also help you sleep if you are having any sleep problems. Yeah, we're going to start you on the low doses, okay? You could start to see some benefits within a week or 2, but it could potentially take up to 6 weeks. So give it time, okay? And don't suddenly stop taking medication without coming back to talk to me, okay? If you find that you don't like them, or you're having side effects that you don't want to have, then by all means come back and we can taper you off. I would say don't suddenly stop taking these, okay? Okay, so which one are you kind of leaning towards? You'd like to hear about the side effects? Okay, yeah, so with triptyline, the side effects usually mild: constipation, dizziness, dry mouth, sleepiness, trouble urinating, muscle cramps or weakness, and thoughts of self-harm, harming yourself. So if you do get anything like that, definitely come back immediately, okay? Now with topiramate, side effects are similar. I think there's less side effects and it doesn't affect your mental health, whereas amitriptyline can. So sleepy, dizzy, nauseous, just generally mild. Topiramate. Yep. Okay, so I will write you a prescription for topiramate. We're going to have 2 doses of 25 milligrams, okay? I'd say 1 in the morning, 1 in the evening. Can also be good spreading them out that way rather than having to wait to the end of the day with the amitriptyline, okay? So we are going to start you at the low dose, okay? And bear in mind, again, it could take up to 6 weeks to properly, have a good effect. Just be patient with it. Yep, so in the meantime, make sure you are keeping that migraine diary, okay? So we'll book you in again 6 weeks from today. Bring your diary, and we'll talk about how well the medication is working. If you have any concerns or questions in the meantime, you can always come in earlier. Do you have any questions for me at the moment? Oh, yes, actually you can. You can take paracetamol at the same time as topiramate. Yep, so topiramate is kind of to help prevent the migraines. If over the course of 6 weeks you do get migraines, it is safe to take the paracetamol as well. Just bear in mind, don't exceed the maximum dose, okay? Good. Alright, well, I do hope that that's gonna bring a bit of relief for you. Your prescription will be ready over at the pharmacy in about 5 to 10 minutes, okay? Great. Yes. Well, thank you for coming. I'm really, really pleased that you've come in and asked for some help with this. Fantastic. Okay, I'll see you again soon. Goodbye now.